How do they treat that? So if it's like a wait and see kind of approach for, or like, they're saying this doesn't require surgical repair at this point because it resolves on its own. What is the interim treatment of the actual symptoms? Because I'm imagining, there's no TMI on this channel because everybody who's watching it is talking about, childbirth. So, but I imagine even things like you mentioned, the incontinence and things like that, like you still have to use the bathroom and everything like that in the meantime. And then like, or just be able to like walk around and pick up a baby and care for a new baby and everything. So what does the care and like what does the actual treatment of the symptoms and pain associated with it look like while it's quote kind of doing its own thing and healing on its own?
Right. So it was a lot of antibiotics. I wound up having a yeast infection in my butt, which was another thing that I didn't know could happen. And at that point I was so frustrated because that was another thing that I felt like nobody was listening to me about. I was like, I have this rash. I am a grown woman. Why do I have diaper rash? What is going on? Somebody needs to treat this. And nobody did. So I think it was 6 weeks when I had that rash. And they were like, okay, well, now we're going to give you an antifungal and we're going to give you like cream to use. They didn't want to do estrogen cream. So it really was just like, keep everything clean. Sometimes it was take sitz baths. And then other times it was like, don't do that at all. If you need, to do something, then just really shallow water, nothing in it, no soap, no, crystals of anything, nothing, just sit in the water as frequently as you can. And I'm like, I can barely move, so you want me to get in and out of a bathtub, like I'm having a hard enough time with an infant dealing with all of this stuff. And the other thing with that was that I was putting so much pressure on myself to breastfeed. So what I found out later on was part of the reason why I wasn't healing was because I was breastfeeding. It was one of those things where like, I knew that I needed 4 hours of uninterrupted sleep, but I was also being told that I needed to wake up every 3 hours and make sure that I was pumping. And then you're cleaning all the pump parts and, so eventually you're getting like an hour of sleep. And so nothing was healing. So, antibiotics, make sure everything's clean, witch hazel, peri-bottle, not much else that you can do, unfortunately. So then eventually like the antifungal worked and the rash eventually went away, but yeah, it was just a mess. And so the colorectal surgeon said she couldn't do any endoanal testing, which is what she was going to have to do to figure out how bad and like how extensive the damage was until I want to say that it was 8 weeks that was the time span that I had to wait. Eventually somewhere in there, I had someone in the safe sleep group because I posted because I was so frustrated about this rash and everything that I was going through. And I made this like frantic post in there and I can't remember who it was, but somebody was like, if you need somebody to give you permission to stop breastfeeding, I'm giving you permission to stop breastfeeding. And I've done that to other people now because it made a difference. Like, because I was on the oxycodone, I was trying not to take it because I was pumping and I didn't want to give Evan that breast milk. So I was pumping and dumping. So I was literally throwing breast milk down the drain. And it was so incredibly frustrating. And like what I could use, my doctors were saying like, okay, you can take it, but, wait, I think 5, 6, 7, 8 hours. I can't remember what the span was. Pump, but then you dump that milk. And then eventually when you can, you can use that pumped milk because it would have been out of your system at that point. And that was an abundance of caution thing. Like his pediatrician said, oxycodone isn't really one of those things that I'm terribly worried about. if you feel like you need to pump and dump, then do that. Or, nurse him when you can, or, whatever. But I was putting so much pressure on myself because I wanted to have breast milk for him, whether it was pumped or nursing or whatever. And then I had to wait 2 weeks to detox off one of my medications to actually be able to start breastfeeding him anyway. So I wound up pumping and dumping for 2 weeks straight. My milk came in at about 5 days. But there was nothing I could do about it. And there are very few things, I think, postpartum that are so frustrating as to literally dump your breast milk that you have worked so incredibly hard to make with your body. Just dump it down the drain. So postpartum anxiety and depression hit me like a truck. I expected them to, just because I've had, anxiety and depression for most of my life, but that's a whole other animal. Postpartum is so different, at least for me. I don't know if it is for everybody else, but I just put so much pressure on myself for like all of these different things. And it took me so long to realize like your body is not healing because you're not sleeping, you're not eating. I didn't gain a ton of weight while I was pregnant, but I probably lost 40 pounds in a very quick span after birth, just because I was so stressed out. I was so sick. It was just a mess. And like people would drop off food and everything, but I couldn't eat. I was so exhausted. I was a disaster. Thank God my husband was so good. And like, he really like took over as much of the parenting stuff as he could so that I could rest. But I was still putting too much pressure on myself to get up every 3 hours. And like, we all know that you need at least 4 hours of uninterrupted sleep to be a safe caregiver. And I just wasn't getting that. And anytime that I would hear him cry, because Ryan, my husband, would have him in the other room. Anytime I would hear him cry, I was up and in the other room. Like it didn't matter if I had a sound machine going, didn't matter if I had earplugs in, I would hear him and I would go. But yeah, so the whole thing was just such a complete disaster. But, I had no idea that I was supposed to expect any of this stuff. So one of the most frustrating things about the whole thing is that nobody's talking about these things. Nobody knows about fourth degree tears. Some people do, but a lot of the time that's because they've had them or know somebody closely who has. And yeah, one of the biggest regrets of my life will always be that I didn't push for that C-section. I didn't know that I could walk into a hospital and said, I don't want to have a vaginal delivery. I'm here. You're admitting me. I want a C-section. I didn't know that I could do that. I didn't know that I could say to my OB, look, you say it's contraindicated, but the only reason that I need to have a C-section is that I want to have a C-section. They have to listen to that. And I didn't know that. And now I'm going to have these issues for literally the rest of my life. When they finally did the endoanal testing, I think it was that August. So I had him in May, and I think in August, they finally did the testing, and I had absolutely zero muscle control. So first of all, very little things, very few things in my life have been as humiliating as having to have endoanal testing. I remember just like laying there on the hospital bed while she was doing these things and saying like, okay, now squeeze. And me going, I am. She's like, nothing's registering. I'm like, I'm doing the best that I can. And eventually they all figured out that the damage was so extensive that nothing was going to help. I did pelvic floor physical therapy, did not help. When they got the results, like the official results of the endoanal testing, they said, okay, you have 3 choices. We can do a surgical repair, or we can try Botox, I was like, you're going to put Botox where? Exactly. How does that work? I remember being so frustrated that I went to my husband and I was like, Botox for your butthole. Like, why would anybody do that? I don't understand. So, so there was that. And I was like, if I don't have a sense of humor about it, then I'm just not going to survive it. But the other option was to have a sacral nerve stimulator implanted in my butt. That was the thing that was going to have the most success. She was able to like make a list of what the options were. So those 3 options and what the success rate was going to be. And I think the repair, which would have been an awful recovery, and for not a lot of time. So that repair would only last a couple of years and I would have to go back in and do it again. And that had a really low success rate. I think it was like 15 to 25%, something like that. The Botox had a little bit higher, maybe like 35 to 50. And the implant had, I want to say 50 to 75 or 80% success rate, but closer to the lower end because the damage was so extensive. And I said, you know, I could do nothing and just continue living the way that I was. I can't leave the house. And so I decided on the implant. They did the implant in 2 different surgeries that November. So now I'm bionic. I lovingly refer to my implant as my buttery. Because I have to charge it. I have to charge the battery. And that in and of itself is frustrating because it doesn't always work. So I would say, you know, I do get relief from the implant. They did wind up ordering a colonoscopy to see if there was something else going on. And it turned out that I've had undiagnosed Crohn's disease probably since I was a teenager, and nobody could ever figure it out. That's probably why they had so much trouble with the repair. But, you know, nobody knew at that time. I didn't know. So that's what the colonoscopy has shown. I still have the implant. I'll always have the implant. They'll have to, you know, take it out and put in a new battery in a couple of years. But with that, I don't have to wear a diaper every time I leave the house, which is something that I had to do for like a year and sometimes still do because the fecal incontinence is so bad. And who would think that just because, you know, you push a baby out, you know, that's not the only thing that you're going to be pushing out. But yeah, I mean, like, we can't go anywhere very far in a car. We wound up having to go on a road trip to Maine when Evan was like 15 months old because my grandmother passed away, and it was awful just because you can't find a battery. You can't find a bathroom. You don't have any warning for when you're going to have, you know, when you're going to need a bathroom. It's so completely humiliating. And it's just a terrible way to live and nobody knows about it. So, that's kind of the way that my life is. There are some days that I can't leave the house. There are some days when, you know, I'm supposed to go up and see my parents who are about an hour away from here, and I can't get in the car because I don't know what's going to happen. Accidents are kind of a regular thing for me. It's getting better. It got better with the implant, but it depends. You know, there's not necessarily any rhyme or reason to when it's going to work and when it's not going to work.
Yeah.
I've been on different medications to try to help, you know, with the symptoms, and there's no guarantee. So that's kind of the way that our lives are now. You know, everybody's impacted. Everybody has a really hard time. You know, it's these are complications that nobody expects to have happen. There's not a lot of support out there. I've found that a lot of doctors don't even really know how to treat these things. You know, everybody said, oh, you know, pelvic floor physical therapy is going to change your life. It's so amazing.
When I talk about your pelvic damage, I said, there's one thing I will tell you for certain: you cannot get it to go back to factory standard. Every surgical repair is going to be a patch job, and how much they can help depends on how much healthy tissue is left.
Right.
So the more damage you have, the less improvement you're going to get. If you have small amounts of damage, you can probably get some serious improvement. But even so, it's not a sure thing. And if you have another baby, you can probably kiss it goodbye, because that spore strain, just being pregnant can do that. You don't even have to pass the baby through your vagina. So how big was he?
He was 5 pounds, 7 ounces.
Oh my gosh, he was a peanut.
He was peanut, and he did that much damage.
My gosh, that kid's
such pointy elbows. He's never going to live it down. And you know, it's funny because in some of the birth care groups on Facebook, they're like, let's talk about how big our babies were. They gave us our 4th degree tears. And I'm like, okay, that's a weird thing to talk about, but sure. And everybody's like, I had a 9-pound baby, or I had an 11-pound baby, and I pushed him out and it was this big. And I'm like, no, I'm always going to win. I'm always going to have the tiniest baby who causes that much damage. It's always going to be nobody.
And he was 37 weeks?
37 and 5.
So he was small even for his gestational age. Not
yes.
Big.
And it was funny because the day that my water broke, I had my OB appointment, and she said, I want to send you for another growth scan. So schedule another growth scan for the Tuesday, you know, the following Tuesday. So I scheduled it, and they called me on Monday, and they were like, I understand that you need to, you know, figure out how big your baby is. And I was like, oh no, I know how big my baby is. I'm holding him here. I know how big my baby is. You can go ahead and cancel that one. But yeah, he was teeny tiny. Completely perfect, but really pointy. Yeah. But yeah, he had no real issues. He did have the rapid breathing, which I wondered if it was a withdrawal thing, but they said that it was more, yeah, they thought that it was more that he was that early and it was a traumatic delivery for him.
They discharged him after less than a week, so he was not doing that badly.
No.
So he was doing okay. When you had your hemorrhage, were you in L&D or were you in postpartum?
I was in L&D.
Oh my gosh. I thought maybe you were in postpartum and they were just being really slack.
No, I was in L&D, and when everybody came in because I was screaming so much, that, you know, the doctors were like, okay, well, she's not stable enough. I didn't know if they needed to move me to ICU or anything, but I wasn't stable enough to move. So they just kept me there. They moved my bed to another room. And I stayed there. That's where they did the transfusions. That's where they did the unpacking. That's where they did everything.
If it hadn't been for COVID times, they probably would have bumped you to ICU.
Yeah.
They probably would have.
And that hospital it has a pretty big postpartum floor. And the way that they described it to me was that it's kind of Y-shaped. So what they were doing at that point was all of the COVID negative moms, people were on one side, and the positive ones were on the other side. And, you know, everybody had PPE. But when I was there, it seemed like people were just kind of all over the place. because they ran out of room. I know at one point they had someone who was pregnant with COVID very badly on a ventilator, and they didn't think that she was going to pull through. I don't know if she ever did, but that was just one of the things that, complicated everything. But yeah, I think they probably would have, because it was May. So we were, and we're 2020.
Ooh.
So it was right. Yeah.
And New York.
We're in New Jersey.
In New Jersey. So, which city?
Yeah. We were in Livingston.
Okay.
So we were living in Bloomfield. Hospital is in Livingston. OB is in Livingston.
So it wasn't one of the big cities. But yeah, the East Coast got hit really hard.
Yeah. Yeah. I mean, we were 40 minutes outside of Manhattan. So everything around us was everywhere. Still kind of a hot zone. Yeah.
Yeah, the whole thing. It was a mess. Mess. Yeah, I was like kind of surprised. Part of me is like, okay, they're discharging her because they want that room empty and they want those nurses freed up. And part of me is like, and they expect the parents to come in and out of the hospital during COVID time. It seems to be it might be better to actually you in and not have you trucking in and out.
Right.
At least they know you're negative now.
Right. Right. And it was interesting because what we were told, what everybody in the parenting classes that we did were told, all of the patients that I knew of who were pregnant at that time were told was, you're going to be on your own. When you have your baby, people aren't going to be able to come visit you. You're not going to be able to get any help. You're going to be in your own bubble and that's going to be it. With me, every single doctor I saw, including my son's pediatrician, was like, you need to get people in to help you. It doesn't matter that it's COVID. Get people tested, get in with you. You guys are not going to be able to do this by yourselves. You're not. So I know that a lot of people, were in their own bubbles. We were like, yeah, there's nothing we can do. It's not just a bring people food situation here. It's a, bring somebody in to hold your baby.
With all those things. The baby, the food, the water,
yep.
Bathing, the laundry, all that stuff that requires you to get up and move around.
Right.
Yeah, I cannot believe she said one and done to you. I mean, a standard question for a postpartum visit is contraception. How are you doing? How's your mental health? Are you planning on having any more children? Yeah, I'm sure she's a lovely doctor, but that was probably the never the right thing to say to anyone, and definitely not the right thing to say to you.
Right. So it's funny because she was recommended to me by my OB, and they work really closely together. And I know that they had several phone calls specifically about me and, what the plan was going to be. But I was like, I don't even know how to answer that question. I'm not sleeping. I don't know. But if I do have another pregnancy, I'm going to have to be very closely monitored by her as well. So it'll be a whole fun team of people